Spine problems are very common these days, basically because of changing lifestyles and the way we sit, work and do our activities. The electricity to run our body is produced by our brain, sends it into our body through the spinal cord. To protect the spinal cord, our spinal canal is formed by the spine, that is the spinal bones. There are 7 bones in the neck, 12 in the chest and 5 in the lower back. They form a protective ring around our spinal cord because it's a very, very sensitive structure which has to be protected. And the nerves coming out of your neck, they supply your hands and the upper part of the body, and the nerves coming out of your lower back, they supply your legs and also your bowel and bladder, that is your urine and stool functions. So whenever the spine is loaded more than it should normally be, the spine can get degenerated. So degenerating spine disease, that is the spine problems which are due to excessive loading of your spine causing degeneration are about 90% of your spine problems. Remaining can be infections, congenital problems, fractures, metabolic like osteoporosis after a certain age, or because of cancers. But predominantly spine problems are degenerative. So when we look at the degenerative problems, we can broadly classify it into 5 stages. It can be the neck or the back, right? So first stage would be developing back pain or neck pain if you do any activity over and above your regular activity. Second stage would be if you're doing a regular activity also you develop your neck or back pain. Third stage would be if it is a neck issue, if a nerve going to your hand gets compressed, you may have pain in the hands. If the nerve going to your leg gets compressed in the back, you can have pain in your legs. Fourth stage would be when the compression is increasing and you may have weakness in your hands if you have a compression in the neck, or if you can have a weakness in your legs if there is a compression in the lower back. Fifth stage is a rare condition, but it can happen where the occlusion of the canal happens. If it happens in the neck, that is the spinal cord completely getting compressed, then your both legs and hands will lose control or you can have complete paralysis. If it happens in the leg, in the lower back, you can have weakness or paralysis of your legs and loss of your urine and motion control. So when a patient has any spine problem, we need to first take a history, in the sense talk to the patient, find out what happened, how it started, what makes it worse, what makes it better, what are the precipitating factors, how it starts, all this kind of history. Then we got to examine the patient. Examining the patient is very important because that will give us a hint as to which stage it is in, whether it is in 3rd stage or 4th stage or 5th stage is the most important thing. Then after that, depending on the condition at hand, we get a few investigations done. That when we X-ray of the spine to see if the bones are in position, whether they moved forward or backward, or an X-ray of your or an MRI of your spine. MRI will show you the situation of the nerves, the discs, the facets, if there is any compression or closure of the canal. First thing we need to understand is our back pain or neck pain is not same as the next person's back pain or neck pain, because there are back pain or neck pain is a multifactorial problem, in the sense various factors in various proportions can cause a person's back pain or neck pain. So we need to identify the cause, especially any pain which lasts for more than few weeks. A mild pain which gets relief without many treatment, with rest, is nothing to be really worried about. You just have to strengthen your neck and back muscles and you're fine. But any pain which is recurring, or if it is not going away, or if it is very severe or associated with weakness, then we need to do the investigations and see what's happening. So when we look at the treatment of the spine problems, especially degenerative spine problems, so if for a patient who is in first stage, that is where you have pain on doing any activity which is over and above your threshold, we need to strengthen your back muscles, we need to correct your deficiencies. If you have any vitamin D, B12, calcium deficiencies, we need to correct it. And that should be the end of your problem, as long as you are taking care of your back. But if you are in second stage and if your pain is coming back whenever you do your daily activities, then we need to see how your activities are affecting your spine, correct them, do some ergonomic modifications. Along with that, maybe use some medication and strengthen your back and neck muscles. In the third stage, when the pain starts shooting down your hands or coming down your legs, then we may have to do an MRI to see how much of compression is there on the nerve, and if it is there, use specific medicines for that. Or if the medicines are not helping and if the nerve compression is not very severe, we can do procedures like in the neck cervical epidural or root block, or in the back root block injection, and reduce the pain. Rarely when there is a severe compression on the nerve which is not getting relief with medication, rest, physiotherapy and or injection in the back or neck, or if the pain is so severe that patient is not able to sit or stand or walk, and MRI is showing a significant amount of compression where we are worried that the nerve is getting injured or damaged, we need to remove the pressure on the nerve. We should not wait for the nerve to get damaged, because nerve is an extremely sensitive structure which once damaged will not recover back. We cannot recover a spinal nerve if it is damaged. Only thing we can do is prevent the damage from occurring by removing the pressure on the nerve. Right? So in that direction, we can do an endoscopic surgery for your neck or your back. It's a small keyhole surgery, about a centimeter incision. There is hardly any blood loss, less than a few ml. I don't have to worry about transfusion and associated complications. And in endoscopic spine surgery, we do not cut and pull the muscles apart. We do not remove the bone. So we do not create any instability or weakness on your back or spine. So your integrity, structural integrity of your spine is maintained, and we do not need to stabilize the spine. We are using of metal instruments, implants, screws and all reduces drastically when we go about in endoscopic fashion. For that we need specialized equipment. We use various standard companies like Richard Wolf, Joymax, Maxmore. We have all the equipment. We have Olympus cameras, 4K scope and screen. We have all the state-of-art equipment, and we do these procedures regularly. I have been myself, I have been doing endoscopic spine surgeries for the last 7 years. One of the first people in Hyderabad to start endoscopic spine surgeries. Done more than 1,000 endoscopic spine surgeries till now with excellent results. So very confidently and with the least possible complications or no complications, we can remove the pressure on the nerve and sort it out. So another condition is called lumbar canal stenosis. This is a very common condition. Unfortunately, we see more and more of it, and it is what we call as an insidious progression. In the sense it progresses very, very slowly. It's like a slow poison where by the time you know that you have the problem, already quite a bit of damage may be done, or the disease would have gone further along. What happens in lumbar canal stenosis is the canal or the pathway through which your spinal cord is traveling gets choked up because of various factors. It is generally seen in people above 50 years of age with previous spine injury issues, or patient may not have any spine issues at all. Some people don't even have back pain. The primary predominant symptom can be reduction in walking distance. If somebody was walking 1 kilometer, 2 kilometers previously without any issues, as time goes by, their walking distance reduces. In the sense, if they walk a certain distance, they may have back pain or leg pain or weakness in the legs or numbness in the legs, or they're just not able to walk further at all, or they have to sit for some time and then they're able to walk a little more. Some people, as the things progress, your legs might thin out, they may start looking thin, or your strength in your foot might reduce, your footwear, your slipper can keep coming out, if you're slipping, or your sensation in your foot will be, you'll feel a weird sensation, you feel like you're walking on cotton or something is poking. You keep checking whether you have some rocks in any stones in your shoes or something like that. And as things progress, you may lose your control of your urine or your stool motions. Especially women, they have frequency or urgency of micturition. That is, if once they start feeling that they have to go to urinate, they will not be able to control their urges. They have to go immediately, or sometimes they may have to pass urine in their clothes also. That also happens. Sometimes you're not able to completely urinate also, because this happens because the nerve supply which controls your urine bladder function is getting choked slowly. So when this kind of a situation happens, we examine the patient. We see how long the symptom has been, how severe the symptom is, how much the walking distance is, and then we do an MRI to see how much of the nerve is getting compressed. If it is not too much, simple exercises and weight reduction and activity modification can give us some more time. If with these and medicines the problem is not reducing, and if the nerve compression is not too much, we can give a special injection in the back called epidural injection, which will reduce the swelling within the nerve and give them some more time, maybe 6 months or 1 year of symptom-free time. But in patients where the compression is very severe, where we are worried that the nerve is getting damaged, or already patients are having some bowel bladder symptoms, that is urine motion issues or weakness in the legs, we have to decompress the nerve. Basically, whatever canal is choked up, whatever canal is blocked, we need to open the block and provide the nerves space to survive and thrive. We can do this in endoscopic spine surgery now. Like I said, small incision, less than 1 centimeter incision, 5-10 ml or less than blood loss. Patient walks the same day, patient is independent the same day, patient does not have to depend on anybody, no prolonged bed rest, no prolonged hospitalization. Patient is given a chance to recover much more fully because we are not disturbing any normal structures in the spine. So we do not need to add implants. The need to put screws in the spine is also drastically reduced, and the risk of the complications also drastically reduced. Even for patients who have 2-3 level stenosis can be operated on the same day through 1 or 2 small holes. The patient will walk the same day, go home the next day and be on their own. They do not need to depend on anybody else. When we are talking about treatment, we need to think about or talk about these unfortunate misconceptions about spine a lot of people have. And the biggest and the most worrisome and most damaging misconception is avoid spine surgery at all costs. Definitely avoid surgery if you can avoid it. Definitely avoid unnecessary surgery. And surgery for spine is required only in a very, very small percentage of patients. But if you have pain which is not reducing with medication and rest, or if you are having to take a lot of medicines, painkillers, which can cause your kidney or liver to go into failure, which is a life-threatening condition, or if you are not able to do your daily activities, say you are a software professional or a bank employee or a politician for that matter, who are not able to do your daily activities because of your pain, then it makes sense for us to sort out the pain and then put you back in your daily activity, because not being able to do daily activities apart from loss of your earning will also result in increase in weight, depression, other psychological issues and various other problems increasing. And definite indication for surgery is when there is a nerve compression, nerve is getting damaged, we should go and decompress the nerve. The nerve in the spinal canal, the spinal nerve or the spinal cord or then any of the spinal nerves are extremely sensitive structures which cannot be repaired. So if they are getting compressed, they will definitely get damaged, and once they get damaged, some amount of disability will remain. If you are lucky, it will be a partial disability. If you are not lucky, it will be a complete disability. If it happens in the neck, you might lose control of your hands and legs. If it happens in your lower back, you may lose control of your legs and urine and motion control. So if you have a problem, now that we can deal with the problem in endoscopic surgery, where you don't have to cut a lot, we don't have to remove a lot of structures, put unnecessary screws, put you in the hospital for weeks or week or 10 days, and no need to put you in the bed without moving for weeks together, where we can deal with all of this in the least invasive and the latest manner. Please come ahead and come over and consult a specialist if you have a problem. Do not let the problem fester and become an irreversible problem and lead to disasters along the way. Thank you.